Today's video is on skin and eye infections. The skin is a pretty good defense mechanism. It has a few different features such as melanin. Your perspiration has an acidic pH, and the enzyme lysozyme, if you remember guys, that breaks down peptidoglycan. Now we have some normal microbiota of our skin. We've already talked about staph a lot in this class. Also, we have a really other cool bacteria that's called Pseudomonas that we'll talk about later that also causes infections under the proper conditions. So you can have different types of skin. It can be oily, moist, dry, and this is just a representation of the different types of microbes that can be found in different parts of your body. Now again, if you take a look here, guys, this is just showing some of the different types of lesions that are out there. We'll talk about some of the infections that will lead to these. So if you look at things like a vesicle up here, this here's a bulla, basically, which is a pretty large type of vesicle that we have. Macula, we'll talk about macular-papular types of infections soon. If you look at this papule here, guys, or what we sometimes call a type of a wart, etc. So again, these are just some different types of lesions you'll see. So the first disease I'd like to talk about, guys, is chickenpox. And please know that chickenpox and shingles are caused by varicella zoster. They are a herpes type of virus. So what that means is that they're something that once you get the viral infection, you're always going to wind up having it. So you'll have a fever with a lot of itching that happens. And a lot of times, guys, what happens is that the virus will go to your peripheral nerves and become latent. So later on in life, guys, what happens is that this will activate again, and then you've got what we call shingles. So again, shingles is reactivation of the virus. It is usually one-sided, and it can cause a lot of pain. You can see a lot of blisters, etc. And there are a few antiviral medications that may limit the outbreak of this. So here's an example, guys, of what chickenpox looks like. That can go dormant. The virus can actually go to one side of your body, and then you would have a rash like this, which we would then call shingles. So there are some vaccines available out there, guys. There was one developed in 1995, and for shingles, we have Zostamax vaccine. It's recommended for people over the age of 60. Now, herpes viruses 1 and 2 in particular, believe it or not, about 90% of people have antibodies to at least one of these two. And again, once you get a herpes virus, you've got it for life. So please know, guys, for your exam that HSV-1 disease is oral herpes. And it can be transmitted by saliva, contaminated fomites, things like towels, sheets, etc. And right here, if you guys take a look at this person's lip, you can see the little vesicles that pop up there. Now, herpes is pretty interesting, guys, because it is a type of virus that can move along nerves. So, and it can be reactivated again and again. Now, some other types of infections of the skin are known as maculopapular rashes. These are small, slightly raised papular lesions. These are not fluid-filled, guys. They're not fluid-filled. They're flat, discolored areas of the skin. Maculopapular rashes, flat, discolored areas of the skin. Please note that there are 5 main types of maculopapular rashes. They're listed here, so please know measles, rubella, rubeola, fifth disease, hand, foot, and mouth disease. All 5 of these are type of maculopapular rashes. So if you take a look at measles, guys, you can have these spots in your mouth called Koplik spots right here. And on the outside, this is your maculopapular type of rash that you would see. And it can spread all the way from your face all the way down to your trunk and then your extremities as well. Rubella is something that we need to be aware of because this particular virus here, the rubella virus, can actually cause, and I'd like you to know this, congenital rubella syndrome. And this sometimes results in stillbirth or miscarriage. Now, if the baby is carried to term, a lot of times there are birth defects, blindness, deafness, heart defects, etc. And look at this little guy. You can see the rash all over this child's face. Fifth disease, please know, is characteristic and of what we call a slap cheek rash. And this one, believe it or not, back in the 1899, was the most common childhood rash illness. And again, it causes slapped cheek syndrome. Roseola, for that, please note that the agent that causes it is human herpes viruses 6 and 7. Now, a lot of people that have this are asymptomatic and often go undiagnosed. Now, if you do become symptomatic, and you can see on this child's face it's red over here, a little bit over here, etc., you get a very high fever. It can cover the whole body. Usually it will go away within 1 to 2 days. However, the fever can sometimes cause seizures to occur. Now, viruses that cause warts are pretty common, guys, out there. Some of you may have heard of plantar warts. These are usually found on the bottom of your foot. You may have things like seed warts, like this, that can be found on your fingers as well. And a lot of times they're spread by touching things. And you touch something, you touch a part of your body, and you what we call auto-inoculate yourself. So just be aware of that. The human papillomavirus, there's actually 50 different types out there. Again, you can get it by direct contact or sometimes indirect contact. And the signs and symptoms depend on the strain that you actually have of papilloma, what you'll see. Acne, some of you I'm sure have heard of. It can be caused by propionic bacterium, acnes, and it's very common. It usually affects 70 to 80% of teenagers and young adults, and you can have different phases of this. The worst would be the nodular cystic acne. That one often leaves scars well into adulthood. Staph aureus causes a lot of different types, guys, of skin infections, and we just call them skin diseases caused by Staphylococcus. The number one cause of staph infections is Staph aureus. However, sometimes you will, if a person is immunocompromised, see a Staph epidermidis skin infection. Now, some of the testing that can be done, and you've done some of this in the lab, or you actually were given results on some of this, they're catalase positive, mannitol fermenters, beta hemolytic, coagulase positive, etc. And they have a lot of different virulence factors as well. And this chart just shows some of the differences between staph infections and strep infections over here. So the first disease I'd like to discuss with you guys caused by staph is impetigo. And it's a pus-filled type vesicle, reddening on the face, lips, or extremities. Take a look here. You can see that crusty look. You can see there's little satellites over here that are starting to eat into the skin. And when it crusts over, guys, it's usually like a golden or honey color lesion. Cellulitis, some of you may have heard of, again, caused by staph. Infection of the lower dermis, subcutaneous fat. very red, painful, swollen, etc. And here is a good example of cellulitis. You can see how swollen the foot is. Again, it's sub-Q, and a lot of reddening there. So that's the end of part 1 of chapter 17.